Okay, moving on to our next panel. Here is the poll question for the second panel. The results. Ooh, 92%. There is psychological impact on the patients. Okay, our second topic, short-term and long-term psychological impacts of cancer and its treatment. The moderator for this panel is Ms. Viji Venkatesh, Region Head, India and Southeast Asia, the Max Foundation, founder of the Friends of Max, and trustee with Being Human Foundation. And our panelists, we have Dr. Sarper Diler from Turkey, a cancer survivor, medical faculty member at Istanbul University, and specialist in cancer counseling. Dr. Savita Goswami, psycho-oncologist at Tata Memorial Hospital. Mr. Vijay Bhatt, a cancer thriver and a founder of Cancer Awakens. And Mr. Sandeep Kumar, a cancer survivor and a strong patient advocate.
Hello, everybody. This is Viji Venkatesh here, and very happy to be moderating this particular panel discussion for the 27th We Care Cancer Survivor Day. I don't think there is anybody in cancer care who is not aware of the amazing week that We Care puts together for each of their Survivor Day. Today's topic, short and long-term effects of cancer treatment on the psychology of a patient. A diagnosis of cancer, more than any other life-altering or life-threatening condition, has always led to severe emotional, social, and maybe even cultural ramifications in life as the cancer patient and his family and his or her immediate support system has always seen it. The initial reactions of denial, anger, self-blame is eventually replaced by some kind of acceptance. It could be acceptance that comes out of pressure. It could be acceptance that that comes from some kind of a fatalistic attitude, but it is acceptance. The whole cancer narrative is then punctuated with concerns regarding availability of treatment, affordability of treatment, change in the role of the patient within the family and the workplace, and the whole disruption and upheaval that the stigma of cancer causes in normal life as one has lived it. It is actually, therefore, a matter of great comfort that today we are looking at more and more curative therapy, which allows a patient to live longer, embrace a new normal, and with a great quality of life. However, we do know that this whole journey will and does leave many emotional scars, which will definitely take a longer time to heal than perhaps even the malignancy itself. The topic set for discussion before this panel, short-term and long-term psychological impacts of cancer and its treatment, is therefore, I think, very pertinent and relevant. And I do believe we could not have better experts than those with us on the panel to do so. It's my pleasure and honor to introduce to all of you Mr. Sandeep Yadav, who is a sarcoma survivor. Dr. Savita Goswami, psycho-oncologist from the Tata Memorial Hospital in Mumbai. Dr. Sarper Diler, medical faculty member, Istanbul University, specialist on cancer coaching, Lymphoma Coalition, Secretary General, Board of Directors, Canada, and Dr. Sarper, a survivor himself. And Mr. Vijay Bhatt, who is the founder of Cancer Awareness. Vijay calls himself a thriver, and I think that's an amazing vocabulary that has been added to all of us who work in cancer. I would like to begin with Sandeep. Sandeep, can you share with us your experience when you were diagnosed with sarcoma, your treatment, what challenges did you face, and how you managed to deal with all the trauma during the course of diagnosis, and of course now as a survivor post your treatment?
Yeah. तो 2007 में मुझको डायग्नोस हुआ था हड्डी का कैंसर सार्कोमा, और शुरू में दर्द और सूजन के साथ में जब भी शुरुआत हुआ तो काफ़ी दिक्कत हो रही थी। घर के आसपास के डॉक्टर के पास हम लोग गए, डिस्ट्रिक्ट लेवल पर गए, पर इसका सही डायग्नोसिस नहीं पता चल पा रहा था। जो भी डॉक्टर के पास जा रहे थे हर कोई बोलते थे कि गांठ है, सूजन है, दवा दो सही हो जाएगा, पर 6 मंथ हो गए थे। एक हॉस्पिटल से दूसरे हॉस्पिटल, दूसरे से तीसरे हॉस्पिटल, एक डॉक्टर से दूसरे डॉक्टर के पास जाते हुए फाइनली गोरखपुर में तो बायोप्सी हुआ, देन डायग्नोस हुआ। फिर हम लोग बॉम्बे गए, मुंबई में, वहाँ पर ट्रीटमेंट चालू हुआ। और ट्रीटमेंट चालू होने तक मुझे जानकारी नहीं था कि मुझको कैंसर हुआ है। और आज जैसे वेटिंग एरिया में हम लोग बैठते हैं तो वेटिंग एरिया में लोग आपस में बातचीत करते हैं, फाइल देखते हैं, तब जाके जानकारी मिला कि हाँ मुझे भी हो गया है कैंसर। उससे पहले सिर्फ यही जानकारी था कि हमको ट्यूमर हुआ है, और ट्यूमर का सचमुच क्या मतलब होता है वो भी नहीं मुझे समझ था। कुछ मेरी उम्र उस समय 12-12.5 साल थी, और उसके बाद शुरुआत में 6 कीमोथेरेपी चले, फिर उसके बाद सर्जरी हुआ, राइट ह्यूमरस पूरा रिप्लेस हुआ। गांव के डॉक्टर बोले थे कि हाथ काट करके निकालना पड़ेगा, एम्पुटेटेड हाथ को करना पड़ेगा, राइट हैंड में था। मैं उसी हाथ से लिखता था और सारा काम करता था। मानिए एक हमारे घर वाले रो रहे थे, तो मम्मी पापा रो रहे थे, और मुझे जानकारी नहीं था। जब मुझे जानकारी हुआ तो बहुत बड़ा शौक लगा कि अगर मेरा हाथ निकल जाएगा तो मैं आगे की लाइफ कैसे जीऊंगा। पर ट्रीटमेंट चला और लोग का सहयोग मिला, फाइनेंशियल भी बहुत सारी प्रॉब्लम थी, बहुत सारा संस्था एनजीओ आकर के हेल्प किया, वी केयर फाउंडेशन भी, और सेंट्रल गवर्नमेंट से भी फंड मिला, और फाइनली हाथ बच गया। सर्जरी जब भी हुआ तो हाथ बच गया, और बट बोन निकाले थे, उसके साथ से वेन वगैरह बहुत सारी निकल चुकी थी। तो मेरा हैंड राइटिंग मतलब हाथ हिलता ही नहीं था, उंगलियां नहीं हिलती थी बिल्कुल भी। तो 6 मंथ फिजियोथेरेपिस्ट के साथ काम करा बहुत, उसके बाद उंगली रिटेन राइटिंग फिर से आया। फिर मैं आगे का 6 कीमोथेरेपी, फिर सर्जरी, फिर 8 कीमोथेरेपी लगा। टोटल 1 साल का ट्रीटमेंट चला, मैं बिल्कुल ठीक हो गया। उसके बाद गांव गया, आगे की पढ़ाई चालू करा। 10वीं का एग्जाम उसी हाथ से लिख करके दिया, तो लगभग 70% मार्क मिले थे। 12वीं 67%, ग्रेजुएशन भी करा, और पीजी पोस्ट ग्रेजुएशन में 3-3 घंटे में 32 पेज के पूरे होते हैं, वो कॉपी जो भरना होता है वो मैं उसी हाथ से लिख करके, तो जो मेरे लिए बहुत ही बेहतर रहा कि हार्ड वर्क करा, मेहनत करा, राइटिंग रिटर्न आया, और प्लस अपना एकेडमिक में भी अच्छा परफॉर्मेंस दिया। मैं भी लैपटॉप चलाता हूँ, कंप्यूटर चलाता हूँ, बाइक चलाता हूँ। या
संदीप, आप तो मतलब शाइनिंग स्टार हो, आप उदाहरण हो हम सब लोगों के लिए। किस तरह से आपने इतने अपने बचपन से, मतलब 12.5 साल उम्र के थे, और listening to you, Sandeep, talking about how you were barely 12 years old when you were diagnosed, and till a very long time you had no idea that your diagnosis was cancer. You had to come from Gorakhpur to Tata Memorial Hospital in Mumbai, and that's where the diagnosis was made, and there was a chance of your hand being amputated because of the sarcoma. And I cannot imagine what must have gone in your mind. I sometimes feel it must be the inherent, in children we find, Savita would be able to better explain this, how children factor everything into their consciousness, and there is no questioning, and whatever is the reaction to a diagnosis is actually an unquestioning response. And Dr. Sarper, for your benefit, because Sandeep was expressing himself so beautifully in Hindi, Sandeep also says that there was a great fear that his right hand, with which he was doing everything, he would be losing this hand, but surgery was done in such a way that Yes, there was some nerve damage, there was some bone tissue damage, but with that very hand, he went on to write his high school examination and then his postgraduate degree. And Sandeep, thank you, beta, for sharing. जैसे मैंने कहा, आप हम सबके लिए उदाहरण हो that yes, cancer and its treatment poses many challenges. And of course, Sandeep also says that the support he received from the central government sources as well as non-profits like We Care and a few others have really helped him and his family cope with this trauma. Thank you, Sandeep. Hats off to you.
Thank you very much.
I will now ask Dr. Savita Goswami. The very fact, Savita, that that you serve on Tata Memorial Hospital's faculty as their psycho-oncologist is proof that it is now widely accepted, by all the fraternity, by all the stakeholders in cancer treatment, that patients do indeed undergo severe trauma. Post-treatment and professional intervention is of utmost importance. It would be wonderful if you could take us through how you and your team in the hospital address this reality. And if you also think that patients everywhere do have access to professional counseling, and are they aware of it? And when they do want to access it, how freely is it available to them?
Thank you, Vijay. Thank you for the question. And it's very broad question, but I will try to, give the appropriate constraint and answer related to that. Thank you, Sandeep. And the introduction which you have given, Vijay, which expresses the initial journey, how it starts, and the emotional turmoil starts very beginning, when the investigation process starts, when the person starts sensing that something serious might come up. And there is no time to go through that emotional reactions, people are busy doing investigation. And when it comes to the diagnosis, when the diagnosis is confirmed, then probably it's a big shock, it's a big jolt, which is again never been settled down or not resolved. And immediately they have to start with the treatment, because as we all know that the time factor is very, very important in cancer treatment. So there also many times people don't get enough time to settle down their reaction. So this emotional journey most of the time in the beginning is more of a suppressed, the feelings are suppressed, not shared. And when it comes to acceptance of the disease, there's too much of hassle and too many reactions, as you very rightly said, that there are a lot of emotional reactions in the beginning. And that could be denial, and sometimes it's severe depression, clinical depression also. So that definitely comes in the process of acceptance to begin with the treatment. And when these patients are referred to us as for psychological interventions, because they are not ready to go with their treatment, many of them are so depressed that, and the reaction are many times like crying spells, persistent crying spells, feeling of worthlessness. There's no life further, so why to take the treatment? So people are not ready to accept this. So they are referred to us, and at that point, it's very important to release that trauma. It's very important to give some ventilation to those feelings, because it's unspoken many times, unaddressed, because everyone is taken that burden, family is busy. So patient is quite bothered with all these things. So as a psycho-oncologist, it's a tough task to address all those factors, because we all know our family system, our societal system is so diverse. So each one's problems are triggered by different factors. It could be the manpower, it could be the financial issues, it could be a time of treatment, or it could be the stage of treatment and the family setting. So addressing that, finding out, taking the detailed history, doing the distress assessment, and after doing that, coming up to the interventions to release this distress is very, very important. And that is something which, takes a bit of time. But we also need to understand as a psycho-oncologist that whatever we do, the time should be taken into consideration and patient should go back to the treatment as early as possible. And therefore, at this point, we take a lot of support from survivors. We take a lot of support from other clinicians, volunteers, which help in the process. But the clinical assessment, psychological and psychiatric assessment is very important, because we all need to understand that it's not just the personality, it's not just the cancer illness. There are so many other factors like past coping of the patient, how he and she has the support system at home, how he and she has coped up with previous life experiences. Everything needs to be considered. Many times the psychiatric background, many people come with previous psychiatric history. So all that needs to be taken into consideration, and accordingly, each one will need specified interventions. So, and I'm really very glad that, as you said, that how the services are existing in current situation. So in last 5 to 7 years, I must say that the awareness is increasing. Many psycho-oncologist network is getting strong. Many psycho-oncologists are working with different centers. But yes, still, people, those who are staying in interiors, they're not much aware of the importance of getting support at right time. And even the referral pattern needs to be strengthened so that they are referred rightly to the appropriate centers for counseling or therapeutic management. And one thing which I would like to say, Vijay, that in the coping and the initial reactions, there are differences, age-appropriate differences also. So adults, men, women, children will react differently. And we definitely have to have tailor-made and specified approach for each and every one for them. So that kind of training, strengthening of services, definitely we need a lot of work on that area. But I'm really very glad that many main centers have this kind of services. And there are like these kind of panel discussions and conferences, seminars, workshops that really creates awareness amongst the professionals also, those who are referring patients to different services. Amongst them, as well as the volunteer network, the counselor network, the awareness is increasing. So need, definitely there is a need, and addressing at appropriate time is really very important. I must say that. Yes. Yes, Vijay.
Excellent. You said that you will try to answer the question, which was really very broad, but you have really put everything in a very nice nutshell. And I know that we will have time after the initial round of sharing, and I'm sure we will all have further questions to ask. But yes, some of the things you mentioned, about the patient profile, the age of the patient, gender, role of the patient, and the stage of treatment. Yes, these really make a very big impact. We will now move on to our international faculty. Dr. Sarper, we're really happy to have you with us and look forward to some very special insights on how this particular issue is managed in your part of the world, being someone who has gone through the experience of a diagnosis of cancer yourself.
Vijay, I'm very happy to be in the panel with this excellent people. And I'm just hearing the excellent work We Care Foundation is doing from the other side of the world. So congratulations to We Care Foundation and to all of you. And greetings from Istanbul. Actually, I'm a medical doctor, a staff professor in Istanbul University, transplantation immunology, but I am also doing a lot of things like championing, not only survivorship, but championing for cancer, that I may talk a little bit just in the discussion period. So as I have different hats, being a kidney cancer patient, but also a medical doctor, a scientist, and a caregiver, because I lost my brother years ago in 1990 to lymphoma. So let me start by saying that when I had cancer, I had really experienced the 7 Ds, and those D letters stand for dependency, discomfort, disfigurement, disruption, disengagement, disability, and finally, death. The doctor-patient relationship is of utmost important, and it is evaluating in the West, and I hope in developing countries this is going to be the same. It started from medical paternalism to enhance autonomy. I have felt, I mean, without having exchange of information, enabling patient for self-management, managing uncertainty, making decisions, and fostering healing relationship, you cannot get a good outcome. So as I said, doctor-patient communication is crucial. For that, you have to enhance the therapeutic nature of the medical encounter, manage problems in doctor-patient communication, important contributing to clinical reasoning, that will bring the greater patient satisfaction as well as the physician satisfaction. Let me tell you that 45% of the patient concern are not elicited during the doctor-patient communication, and this is a sad fact. And besides that, 50% of the psychosocial problems are missed. So in the 50% of the visits, the patient and the doctor do not agree on the nature of the main presented problem. It's only a minority of health professionals. It doesn't matter if you're living in a developed country or an underdeveloped country or a developing one. Only a minority of health professionals identify more than 60% of their patients' main concerns. So doctors often pursue, I'm talking this as a doctor as well, is a doctor-centered closed approach to information gathering that discourages patients from telling their story and voicing their concerns. So patient-centered communication is the integral part to patient-centered approach, and physicians has to try to enter the patient's world to see the illness through the patient's eyes. I see the doctor is the drug in a way that is clinical empathy is a clinical procedure, but due to time I'm not going to talk a lot. But as a patient, what I wanted from my physician is the trust, the competence, the efficacy, treatment with dignity and respect, and how my sickness will affect my life, my family, my friends, my finances, and my future. So just shortly, in the diagnosis period, there's the feeling that I could die from this disease. In the completion of the treatment, you say, I have survived now, so will it return back? In the palliative treatment time, you say, I would like to die, so that's a sort of depression and anxiety. And if you end up in a terminal case, you say, I'm dying. Just to tell you that fear of cancer recurrence is a very important issue, and among the most commonly reported psychosocial issues for cancer survivors. For specific to lymphoma, where I work as the board of directors, in 2018, Lymphoma Coalition Global Patient Survey on Lymphomas and CLL found that 43% of the patients experienced this cancer recurrence fear, and 72% experience after the treatment. So it's also reported to continue up to 8+ years for treatment by some individuals. So the bottom line is cancer care never gets into the meat and potatoes of a real cure without fully taking care of the psychosocial effect. If I have some more time to conclude, the patient is not just a group of symptoms, damaged organs, or altered emotions. The patient is really a human being, at the same time worried and hopeful, who's searching for relief, help, and trust. Thanks.
Thank you so much. You have expressed it and explained this in such a brilliant fashion. When you talk of the one word that leaps out of what you said is dignity. That is what we need to accord. I'm sure everybody will agree with me that just because an individual is diagnosed with cancer, it doesn't rob that individual of his existing identity. He doesn't stop, he or she doesn't stop being who she is, and doesn't become only a cancer patient. I think that is something which is really important. And coming from you, a physician yourself, in India, we lost recently one, we call her the doyen of cancer care in India, Dr. V. Shanta. And I saw a video she had shared with all the alumni of the institute where she has been working for more than 65 years. And her message to the physicians is to be kind and compassionate to the patient. First and foremost, be kind and be compassionate to the patient and to the patient's family. And Savita has already told us, and it's not just in one hospital, in one city in the country. I think this aspect is very highly valued and deeply acknowledged by all healthcare professionals. I will now come to Vijay. Vijay, but like I said, I will not call him a survivor because he has given us this word thriver. So Vijay, a thriver as you call yourself, you have worked very hard in overcoming many a hurdle from your history of your diagnosis, your treatment, and moreover with your amazing tool which you call Cancer Awakens, you are empowering many others. And I think the key word here is also empowering. You're empowering so many others to take, so to say, the reins of recovery, into their own hands, the reins of treatment and reins of recovery into their own hands. And well, we cannot wait to hear about it in your own words, Vijay.
Thank you so much, Viji. And big thanks to Savita, to Sarper, and also to Sandeep for setting such a wonderful stage. I'd like to just echo first what Sarper said, which is that when the doctors are treating your disease, who is healing the person? And so I believe that the healing part of it, not so much the curing part of it, which the treatments and the doctors and the medical system can do very well, but the healing part of it tends to get neglected. And in that process, in my view, the patient or the individual has to play a very important role. The individual cannot just be a passive recipient of treatment. They have to actively participate in their own healing. So actually, our work is really based upon the idea that, as Sarper said, the doctor-patient relationship and the transfer of power from the doctor to the patient in terms of taking ownership of their journey is very important. I'd also like to say that in our work, since we are talking about the psychological impact and the mindset, we have basically come across three mindsets, which we see again and again and again. And these three mindsets are, it does not matter what your age is, what your geography is, what your socioeconomic status is, what your education is. These, I think, are human mindsets. And the first mindset that we see is the mindset of a victim. This is the mindset of somebody who says that I did not deserve cancer. Somehow I have cancer. I now have to deal with it. And my life is never going to really be what I hoped it would be. And so I remain a victim. And by remaining a victim, actually, I reduce my own chances of healing because it compromises my immunity further. So we call this the victim mindset. And you will see this in many people who we all come into contact with. Even after years of having remission, they will still be victims of cancer and victims of life. The second group of people are the people we call the survivors. And these are the fighters. These are the people who use their willpower and courage, and they use all their resources to basically say, I'm not going to let cancer defeat me. I'm going to defeat cancer. And while this is a very strong and very powerful attitude, and we encourage people to take this attitude, we believe that this is not enough. We believe that there is a third mindset, which is what we call the mindset of a thriver, which is to look at cancer as an adversity that is going to actually make me stronger in the way I lead my life. And so rather than treating cancer as a death sentence or an opponent or an enemy to be fought, can we start to look at cancer as life's experience that is going to make me stronger and this can contribute to my own healing. So in our work, what we try to do is to take people as much as possible towards that mindset from being a victim to being a survivor to being a thriver. Now, this is not an easy process, because obviously all the reasons that have been given, whether it is the social situation, whether it is the medical situation, whether it is the financial situation, and yet there is a certain kind of resilience which is there inside a human being. There is a certain kind of a quality that is there inside a human being. And I believe that this quality has to be understood and tapped. And my honest opinion is that it cannot happen when the person is in the middle of their treatments. It cannot happen in the hospital. It has to happen afterwards, because as we all know, cancer is a chronic illness. It's a long-term illness.
Yes.
And therefore, the psychological impact of cancer needs to be dealt with at every stage in the journey of that patient, whether they are in the treatment or whether they are not in the treatment. And to that extent, even though main centers like Tata Memorial have incredibly experienced and talented people like Savita, others who are helping, when you look at the patients, what happens after they go home? What happens when they have to get back to work? What happens when they have to deal with life on an ongoing basis? Where is the support going to come from for their psychological, emotional needs? So one of the things that we try to do is really not get into the medical or that stage of the illness, because we feel that most people get reasonably good care there. Our work starts when the treatments are over and when people go home. Now they are on their own. Now they have to make sense of the rest of their life. Now they have to figure out what happens to my work, what happens to my finances, what happens to my children's education, what happens to my daughter's marriage, what, etc., what happens to my relationships, etc. And so we believe that rehabilitation of cancer and dealing with the psychological impact of cancer, the real work starts after the treatment, and the real work must also include the family, because cancer is not a single person's disease. Cancer actually is a disease that affects the whole family. And if the patient tends to be neglected, then imagine what happens to the family, right? So our effort is to try and broaden out the scope of psychosocial or psychospiritual interventions so that the patient feels supported after they finish their treatments, and they feel supported along with the family. So that is how we have designed our coaching protocol. I hope that is a helpful addition to what Sandeep and Savita and Sarper have spoken.
Absolutely. I would like to pick on the one word you used, which we all kind of did not, we kind of strayed away from, the word victim.
Yeah.
You know, because I think it's a very, very powerful word. It's a word that lays open and, you know, lays bare the whole persona of a cancer patient. I would definitely like. I think we have definitely around 10 minutes more. So maybe if each of the members would like to, yes, Dr. Sarper, would you like to say something on the patient being viewed as a victim and the patient himself or herself victimized by all of it that the cancer treatment involves?
Excellent presentations. Just 2 points to make. The first one is a comment to Vijay. I mean, he should normally should not separate the psychosocial care of the patient. I don't know how it happens in India and in other parts of the world, but what we try to do as our patient organization, we just try to be within the interdisciplinary team. And so that's a sort of collaboration where we have the MDs, the social workers, the nursing, the spiritual counselor, psychologists, and in the center we have the patient and the family. This is the first thing that I want to quote. And the other thing is that, I mean, I'm a cancer survivor. Cancer survivors, most of the time, stay isolated in their own world and trying to get adapted to social life, and that's difficult. what patient organizations need to do is that I'm also writing a book on this subject, is to take the cancer survivors from their part of the world and let them empower them to be a champion, right?
Yes.
So that they can help other cancer patients who are left alone. So, and I'm trying to figure out the prevention side and post-treatment side, where they can be champions of the cancer world. And Vandana is surely be one of the ones, because at the end of the book, we're gonna have people who are champions worldwide, and Vandana is gonna be a champion that we're going to be citing in the book.
Wonderful. Yes, Savita.
Yeah, I perfectly agree with Dr. Sarper, because I do feel that the multidisciplinary approach in psycho-oncology, in oncology, is very, very important, because we cannot separate the factors, the medical and the psychosocial factors. They're so integrated, so we cannot separate them. And that is why the work, the rehab, and even the empowerment comes together. The medical issues, when we address them, then probably many psychosocial issues are taken care. And when we support them for psychosocial care, many, even the physical pain and perception of physical pain is taken care. And even the medical issues are then tackled very well, even that the financial support or any other factor. So what we have seen, and the model which we follow, is multidisciplinary approach in oncology care. And where I would like to comment on the word victim. If we perceive them as victim, then it becomes the judgment,
Correct. Yes.
So we don't have to judge anyone by their reactions, because those are situational reactions. That person may be very empowering, very motivating previously, but the situation currently is so traumatic and helpless at times, because scenario has changed upside down. So it can make somebody feel victimized or feel helpless at that point. So I feel helping at that point, or empowering as that point. Empowering is, I think, more appropriate word, because we don't have to take onus. We have to strengthen them to take care of their problems and their issues. And therefore, addressing it being unconditional, non-judgmental, is very, very important. And psycho-oncology is following the same principle. And also, I agree with Vijay that when they go back home, there are many uncontrolled situations, probably which are out of the purview of the hospital or the hospital staff. So when they are taking treatment, that is the time when we need to empower them, and that different perception of taking charge of the situation can be inculcated at that point. And if we train them slowly at that point, that how situation can be seen differently at that point, how the situation can be handled differently. And this can happen slowly, because they have multiple issues to manage. So various psychotherapies are specialized for this kind of approach, say at cognitive behavior therapy, behavior modification, psychoeducation. And I agree with Sarper that information provision is very, very important, which empowers a person that, yes, this is the thing I should do, and because I know I can handle this. So that approach is very important. So giving information is very important. So I definitely agree with all the speakers, the very valuable point. And dignity comes with empathy. So all the professionals and people dealing with patients and caregivers to address their distress, they have to have empathetic approach.
संदीप, आपको कभी भी लगा आपके डायग्नोसिस के समय पर कि आप विक्टिम हो, आप मतलब एक बहुत ही ऐसी बड़ी चीज की शिकार बन गए हो, और आपके हाथ से अपने आप को संभालने का जो ताकत है वो निकल गया है?
Actually, yeah, ma'am. In the initial phase, हमको ऐसा लगता था, बहुत ज्यादा फील होता था. एक बार की बात है, एट्रिक में मैं था, वी केयर फाउंडेशन की पूरी टीम आई थी, और वहाँ पर वो सॉन्ग चला, इतनी शक्ति हमें देना था मन का विश्वास कमजोर होना, और लास्ट में हम होंगे कामयाब एक दिन. फिर वही चीज मेरे माइंड में हमेशा जो है चलता रहा. हम होंगे कामयाब। और कहीं ना कहीं वो चीजें जो चलता रहा, ट्रीटमेंट कंप्लीट हो गया। एक चीज और थोड़ा सा जोड़ना चाहूंगा मैं, आफ्टर completed my treatment and education, and I started to work with the We Care Foundation. Before that, got Sanjeevani, and really Sanjeevani is like Sanjeevani Booty, and we completed a course from Tata, from the TIS and the Tata Hospital. And Savita ma'am was there, and also I met you. So of course complete होने के बाद मैं तो वी केयर के साथ काम करना शुरू करा, हॉस्पिटल में जाकर के पेशेंट से मिलना, अपना स्टोरी शेयर करना, इमोशनल सपोर्ट देना। तो वो जो चीज था कि मुझे कोई आकर के नहीं मिला था मेरे ट्रीटमेंट के टाइम पे कि मुझे खुद कैंसर हुआ था, मैं ठीक हो चुका हूँ, क्योंकि मैं जिनका अभी ट्रीटमेंट चलता है, जो लोग ठीक हो जाते हैं तो अपने घर जाते हैं और आगे की लाइफ देखते हैं। पर मैं ऐसा सोचा था कि जब मैं इससे ठीक हो जाऊंगा तो मैं आऊंगा फिर हॉस्पिटल में, मैं हॉस्पिटल में काम करूंगा, और जो दूसरे कैंसर पेशेंट है, उनके फैमिली मेंबर है, आई विल सपोर्ट देम। और ये सिलसिला चालू हो गया था 2016 से। फिर मैं एक्सेस लाइफ फाउंडेशन और उगम, जो सबसे बड़ी चीज मतलब मेरी लाइफ में लाइफ बदल दिया, हमारे जैसे बहुत सारे सर्वाइवर्स का सपोर्ट ग्रुप है, इंडियन कैंसर सोसाइटी का एक पार्ट उगम है, तो उसका मेंबर बना, जो सचमुच मुझे एम्पावर करा, मुझे बताया कि मेरा वैल्यूज क्या हो सकता है। एम्पावरमेंट की बात जैसे तो विजय सर कर रहे थे, इसके अलावा कैन किड्स और एक्सेस लाइफ फाउंडेशन, इन सारी संस्थाओं के साथ मिलकर के जो काम करा पिछले 5 साल से। और अभी मैं लगभग 1000 से ज्यादा तो सर्वाइवर लोग का सपोर्ट ग्रुप संभालता हूँ के, उसका नाम है किड्स कनेक्ट। और इसके अलावा स्पंदन ग्रुप को भी मैं लीड करता हूँ, जो सार्कोमा ग्रुप है इंडिया का।
तो संदीप, किसी भी नजर से, किसी भी तरीके से हम आपको देखेंगे तो आप विक्टिम तो बिल्कुल थे ही नहीं, लगे भी नहीं। And I think what comes out of what Sandeep has said just now is that he never felt that way, because right from the beginning, he was in touch with so many influences that gave him power. There was a facility where patients could be trained to become patient leaders, patient advocates, and I'm sure everybody will agree that a patient's best advocate is the patient himself or herself, because जिस नजर से आप अपने आप को देखते हो ना, उसी नजर से पूरी दुनिया आपको देखती है. The way you look at yourself, that is the way the world looks at you. And Sandeep, thank you for sharing this with us. और आपने empowerment, you use the word empowerment, and the patient's voice, and all of us, you know, as a team, from the healthcare professional to the social oncologist to the NGOs, to the non-profit sector. Sandeep has taken the name of almost all the non-profit organizations in the country that really do an amazing job. And Vijay, listening to the voice of the patient, how practical has it been? You know, yes, you raise your voice, you empower others to raise their voice. Maybe if we could, in concluding, maybe if each one of you, could just say something about in the work you do in combating the impact of cancer treatment, is your voice heard in the right corridors?
So, great question, Viji. What I would say is that as many of the panelists have said, every individual is different, and every individual approaches an illness like cancer very differently. And so therefore there isn't really a kind of a single message or a single perspective that one can offer. But usually the message that seems to resonate with people that I have seen is that, look, you're not the first person to get cancer. You're not going to be the last person to get cancer. Many millions of people have had cancer, and many hundreds of thousands of people have done really well from cancer. Sandeep is a great example. Sarper is a great example. I'm sure Savita knows many examples. I know in all our work, we come across such inspiring examples. So I like to basically try and learn from those people. What have these people done? How have they lived their lives? What are the changes that they have made in themselves? And then I encourage people to take those steps and say, look, learn from the victors, if you want to call them that, or the thrivers, as I call them, or learn from those anecdotes, not the statistics. The statistics will tell you the numbers which might scare you. But the real life stories of people who have done well, those are the ones to go after. And I find that if I use this language, whether it is a healthcare professional or whether it is an oncology conference or whether it is a support group or whether it is a family of somebody, this message tends to resonate with them. And then they get curious and they say, well, what do these other people do? What can I learn from that? How can I participate in that? Because obviously everyone's health and well-being is very important for them. And they will take the steps that they need to take if they are inspired and guided in the right way. So this is what I find the message that resonates most with people. You're not the first, you won't be the last. Learn from the people who have walked this path ahead of you and have done really well, and try and emulate that.
Thank you, Vijay. Savita, the voice of the patient.
Viji, I'm working in this field, and I think I'm working in this for so many years is because it's more of an insightful learning from my experiences with my patients and their caregivers. This is a field where there's a lot of emotional exhaustion when you day in, day out, you're dealing with their experiences. And being a psycho-oncologist, I hear a lot about their sad stories, their personal grievances, their grief. So I have learned more from them, so they have been many times inspiration to me. The way they stood up for themselves, they take stands for themselves in that difficult, adverse situation. It many times taught me also a big lesson in life. So it's more of a give and take. It's more of a, learning from them. So of course, my compassion many times healing for them, as well as their gratification and giving back as in whatever one smile, that is recharging, or that is empowering me also. So for me, I think supporting them, and Sandeep said about support groups. So their voices definitely will be heard when they come together in big numbers, and therefore support group really helps a lot. And me, being a psycho-oncologist, I really reinforce that idea. I always tell them to join in a small groups and take them to the bigger groups. So that is how, giving them direction to come together, and also enlightening myself through their energies is something which is, I think, reciprocating the voices which are together heard in a bigger manner, I think.
Wonderful. Dr. Sarper?
Yes,
Your thoughts,
I just
especially on the
want to
voice
say
of
that
the patient and support groups.
Yeah, I see that patient groups, patient organizations is of crucial importance, bidirectional, right? I mean, each cancer patient has his own experience, and I see the cancer patient organizations is like a bank, right? Bank of experiences. So each patient is putting their experience in the bank. And we should also not only empower the patients, but also the patient organizations, which in turn will give to the community, right? I mean, we need the survivors to get into life, get back to the social life, etc. And this is going to be through the patient organizations. And We Care Foundation is doing a great job, but still needs to be empowered.
Absolutely. And before closing, Sandeep, आपने दो गानों की जिक्र की थी. Sandeep spoke of two songs which have now, not only are they VCare's anthem, but it's become the anthem of all, the whole cancer family. One is, of course, इतनी शक्ति हमें देना दाता, मन का विश्वास कमजोर ना हो. Praying to the power above to give us enough strength so that the faith and belief will never go from our minds. And the other one is an international We Shall Overcome. In Hindi, it translates into Hum Honge Kamyab. And I think that the very cry, which is We Shall Overcome, it's confidence, it's faith, it's belief, it's it's something which tells us that, we are willing to step out of our comfort zones to seek that victory. Even though we've never ever speak of, cancer as a battleground and, seeking defeat and victory. For all of us, I think we are crusaders. Winning over cancer is a campaign, is a crusade. It's taking back what we have lost. So it's always a positive journey. This whole cancer narrative, in olden days, kings used to go on crusades to recover, all that they had lost. And yes, cancer takes away quite a bit. But then again, like I think it was Vijay who said, cancer also gives back. Today, anyone who has faced cancer as a patient, as a caregiver, as a treating physician, as somebody in the support system, there's always been something powerful, something support, something that instills confidence and courage. And yes, but I guess that's because we have all been very smart and taken over cancer and not let cancer take over from us. And thank you, everybody. Thank you also to VCare. Every year during Survivor Day, VCare brings in a new facet, a new vision. And I think all of us are very, very proud to be associated. Thank you to each of the panel members. I hope you all felt that you had a platform where you could share. And I think when we share and with each other, we also learn from each other. Thank you very much. Thank you so much.
Thank you, VCare. Thank you, all the panelists. And thank you, Viji.
Yeah, thanks everyone.
Thank you so much.
What a wonderful session.
Thank you. Thank you.
Thank you.
Thank you so much. So here goes our second poll question for the second panel. Can we have the results, please? Cool. So 90% of people feel that there is an impact, psychological impact can be taken care of. Yeah. So Viji, Venkatesh, there are a few questions which you would like to take on for the panel.
Absolutely. That's an amazing response. 90%, 90.1% says that's really, really positive. Savita, Dr. Savita Goswami, I'll start with the first question that's for you. Dr. Goswami, you interact with many young cancer patients. They have so many dreams and so many aspirations. How do you motivate them to complete their treatment and channelize their energies?
Viji, you always ask difficult questions.
Oh, but this is not my question. This has come to you from the audience.
Okay, thank you for the question. Yes, our youngsters, they are really very dynamic, and they have many things to do in their age. And that is why their dreams are very high. And in this crucial time when they get the disease, that time handling that is very important. So that's why their dreams, their aspirations many times become the channel for motivation, because there is something to look forward, there is something to keep hope for. And at that point, releasing that distress about whether I will be able to fulfill my dream, whether I'll be able to get what I want in my life. So that distress, if we take care and motivate them that look forward, go stepwise, and then there is the target. You have to focus on your target. This is a time, this is a phase which will pass on. So I think their aspirations are many times their roadmap, or there is the hope to look forward. And there are many other youngsters who have done something like this. So it is always helpful to bring that example in the picture. Many times I have also, got people to speak to them, and they have seen the real life example that, yeah, this person has also gone through like me, and now he is doing something what he wanted in life. He is successful career wise, in personal life. So this is something very motivating, because the trauma is imagined a lot rather than the practical. The fear makes it more bigger or larger than life, and therefore people feel that they cannot accomplish the treatment. So if they see the impact of their zeal and hope, how it practically helps them to fulfill the dream, they really take the spirit, or they really fight the illness with the spirit, and look forward to live life to fulfill their aspiration.
Excellent, Savita. That really makes such brilliant sense. And you have spoken about fear and this concern. So, Dr. Sarper, I think the question that's the next question is actually for you, and connects very well with what Savita has said just now. It concerns with the stigma of cancer. Being on the other side of the world, Dr. Sarper, is there any stigma that you also have to face associated with cancer?
Yes, is everybody hearing me? Again, hi
Yes.
from Istanbul. The answer is yes, whether you live in India or in Turkey or in the United States. You have to change your mindset to cope the problem. Cancer is a stigma in different ways. Some people have fears in developing countries, but in developed countries, most of the people tend not to see the problem, right? They neglect the problem. They don't see the problem. So, for me, the complete cure in cancer hangs in the balance without tackling the psychosocial issues. In other words, treating cancer patients without solving the psychosocial issues is really a misconception. I'm a little bit cynical about policymakers because when you talk to a policymaker in India or in any other country, they give you the impression that they understand you and they are inclined to focus on your problem and solve your problem. But this is not the case in most of the times. So the issue, the psychosocial issue on cancer patients has to be highlighted over and over and again, and I appreciate what VCare Foundation is doing right now so that the policymakers will feel that they have to reckon with this problem seriously and empower the public and the patients so that they stand up and express this problem.
Thank you so much. Yes, Savita, you have something to add to this? Because I have a question for Vijay. Vijay, how does spirituality help in the cancer journey? This is a question that has come. We are running out a little bit of time, so if we can have a brief answer, but I know that Vijay, you're an expert, so I know that you'll be able to give that answer in the time given to us.
Thank you, Viji. It's a great question, tricky question. Before I answer the question, let me just say how nice it is to see so many familiar faces, all of us who have been working in the field of cancer for a long time, including people who are here based on their personal journeys, as well as the audience who's asking these questions. So my experience with this, with the issue of spirituality is, I like to think of spirituality in the sense that people are asking fundamental questions about themselves and about their existence, to which there are no clear answers. So to me, spirituality has to do with questions like, who am I really? What is my identity all about? What really matters to me? What is going to be the long-term purpose of my life? How do I connect with all the forces around me that are bigger than me, which I don't understand? And so what I have seen is that any serious illness or any kind of life adversities surfaces these questions. And cancer, because it's a disease that people associate with death, or people have to confront our own mortality when any of us gets cancer, these questions get surfaced. And unfortunately, there are no pat answers to these questions. These are questions which require individuals to be guided, but ultimately they have to do the hard work of arriving at their own answers. And I find that this ecosystem that we are talking about, whether it is the medical practitioners, the support groups, the advocates, the cancer coaches, the counselors, the psycho-oncologists, etc., I think each one has a small answer to this big question. And in my view, what individuals have to do is to pick up these answers and string them together until they find something that really works for them.
Vijay, that's very, very true. We have to stop now because our time's up. But I know that our viewers can reach out, and I know that VCare will make it possible for all participants, viewers, to reach out and ask their questions on any other platform. You know, this is a topic that we can discuss till the cows come home, literally. Thank you so much, my wonderful members of the panel. You have been amazing. Thank you. And of course, once again, thank you to Vandana, Jyoti, Jogita, and the whole amazing team at VCare for bringing us together.
Thanks, everyone. Bye-bye.
Thank you so much.
Yeah, thanks. Insightful discussion and making all of us aware of how important it is to speak about one's experiences so that many out there can be motivated to do the